Just life gets complicated. We're not just medical students, we're human beings with things that come
Right.
up.
Hi, welcome to the latest edition of The Current, Touro University, California's alumni podcast. I'm Glenn Faison. I'm up in the Alumni Relations Office right now on the campus of Touro University, California, here on Mare Island in California. Joining me today is Dr. Robyn Young, a doctor of osteopathic medicine graduate of 2012. She's in private practice and in the Orlando, Florida area. Thank you for joining us, Dr. Young.
I'm happy to be here. It's an honor. Thank you so much, Glenn.
So are you actually in Orlando or in one of the suburbs?
Actually, I live in Orlando proper. I really like living here. It's changed a lot in the last decade, and it's quite a culture shock going from the Bay Area to Orlando. But our practice is actually in Ocoee, which is one of the suburbs to the west of Orlando. So think, get on the freeway, drive towards Tampa by like 30 minutes, and that's where Ocoee is.
Okay. So less than to get to San Francisco from Bear Island.
Yes, yes.
Yeah. It's about 40 minutes from here,
Yeah,
depending
yeah,
on
I remember
traffic.
that. Oh, I so miss that drive though. It's a pretty drive.
So you've been in private practice. What led you to a career in osteopathic medicine?
So, I did my residency at Florida Hospital East Orlando, which is now called Advent East, and I did the Family Medicine Neuromusculoskeletal Medicine program, which is a 4-year program that leads to dual board certification in family medicine and osteopathic manipulative medicine. And when I was in my intern year, I met an attending there. His name is Billy Taylor. And I learned a lot from him during my intern year in terms of him helping me with precepting patients and helping me decide what tools to utilize when it came to manipulation with my patients in the clinic. And then that's kind of where that ended. I went through the rest of my residency, the subsequent 3 years, and then Elena Tomashkin, one of my friends from residency who was then an attending, grabbed my attention. She told me that he was looking for somebody to add to his practice. So I was like that, thinking that would be absolutely perfect. I had been moonlighting somewhere else at the time, and I was thinking I would start working for them. So that started this sort of back and forth. Okay, what kind of practice do I want to have? What do I want my life to look like after residency? And ultimately chose this practice that is physician owned. And there are currently 6 physicians as employees under the main employer. It's a beautiful practice. We see so many patients because we accept insurance. So it's a very high volume, very rapid pace, but you never get bored.
Well, that's great. So why did you choose to attend Touro University, California? There are more uh, colleges
Oh,
of
there's so many
osteopathic
more.
medicine now than there were in 2012, but there
That's
were
true.
a number of them then.
Yes, so I had a lot of schools to choose from. Ultimately, I grew up in California. My family is actually from the East Coast, but we moved over when I was very young. So I consider myself a Californian. And I wasn't ready to leave the state at that point. I really love California. My family still lives there to this day, most of them do. And so I looked at both the comp school, Western University, and Touro, and I applied to both. But ultimately, what skewed me more towards Touro, because I happened to get into both schools, they were both incredible schools. Like, hands down, I think I would have had a great education at comp as well. But with Touro, there was that extra element of osteopathic manipulative medicine and the mentors in that particular department, honestly. And I knew that they were good there because I went to UC Davis for undergrad. And at the time I was an undergraduate, Jim Binkard was visiting quite often. He'd come by almost once or twice a year with the outreach coordinator from Touro at the time, and they'd give these presentations, and I'd be like, yeah, yeah, that's what I want to do. And then my uncle happens to be an osteopathic physician who works in St. Louis. And when I told him I was pre-med, he was like, well, you want to do this. And he had me come over. I actually went and shadowed him for a week. And he gave me all the books to read, Dr. Fulford's Touch of Life, Andrew Weil's Spontaneous Healing. And he's like, this is you. And I was like, yeah, this is me. So having that idea already in my head and knowing that I wanted to enrich that aspect of my skills to become the best diagnostician I could possibly be, that's what led me to go to Touro.
That's great. Now, talk to us about how Turo prepared you to start your career. I know you do the time on campus and then you go off to residency
Mm-hmm.
or rotate. I'm sorry, rotations. Go off to
Rotations.
rotations,
Yeah.
and then you matriculate and then go on to your residencies.
I can think of so many different ways that Toro prepared me for that. And I think back fondly on it. Back when I was a first and second year, I volunteered at Suitcase Clinic, which I don't know if they're still doing. Suitcase Clinic was this pop up clinic in Berkeley, and it was run by the undergraduate students at UC Berkeley. And our station was to set up OMM tables and do manipulation on just the citizens in need, the people who would come in to get the services. And there were different wings of the clinic. So it wasn't just OMM. There was a section where you could get supplies. There was a section with foot washing and foot hygiene. There were like regular internal medicine sections. So it was just a kind of a well-rounded clinic. And I felt like the relationships I made with my mentors doing that and with the rest of the group doing Suitcase Clinic prepared me very well for kind of those real life interactions with patients. It wasn't the same as just your hands on your partner who's a healthy, like less than 25-year-old most of the time without many problems other than stress on the shoulders, you know. Suitcase Clinic was a big part of that. Also, I was in the Student Osteopathic Medical Association, SOMA, and I worked my way through leadership positions in that, and I felt like that organization and having the experience of going to Chicago and experiencing the House of Delegates and looking at the intricacies of how the politics of the profession, how do we advocate for patients? I did DO Day on the Hill a couple times in Washington, D.C., met with the health legislative aides for my representatives, and all of that under the wing of mentors representing, from my particular district that I vote from. And that was just, all of that was incredible. I could talk on and on about SOMA and how that prepared me. And Touro itself, just the faculty and staff being so incredibly supportive. I didn't have like the smoothest trajectory through my first and second year. I had one unit that I almost remediated on, and I had failed my COMLEX 2, actually, the second exam. For the first time I took it, I had some issues with distractions in the test room, and the computer timer was resetting in a weird way, and I basically had a panic attack in the middle of the exam, and it showed. And so while I never actually ended up remediating my academics, and I ended up passing that exam very well 2 months later, I still had to meet with the committee, and they expressed empathy towards me. And it was especially jarring to have those things happen because I had just gotten the Student DO of the Year award like a few months prior to that. So everybody's like, what happened? Like, and I'm thinking to myself, like, I'm supposed to be this perfect Student DO of the Year. How could that happen to me, And there were quite a few things going on in my personal life, and also, just life gets complicated. We're not just medical students, we're human beings with things that come
Right.
up. So I was just glad to have the faculty and the administration really going to bat for me and understanding my situation. Just being so caring and understanding and being there for me when I pulled myself up by my bootstraps and met them on the other side of it.
Wow. Wow. That had to have been an uncomfortable experience to say the least.
Well, absolutely. Like it's almost seems like it's taboo to even talk about now. But I think that it's important to discuss it because other students will identify with it, honestly. And then I went
Oh,
on to my rotations with this idea of how could I ever get into the residency that I want because I failed my COMLEX once, you know. And I'm here to tell the people that if you've ever struggled, like you can definitely still achieve your goals because I matched into my first choice of residency, even after all that.
wow. And you mentioned Dr. Binkert. I know we've spoken separately about Dr. Hartwig, who's still here on
Oh
campus.
my
Dr.
gosh.
Binkert's required, but Dr. Hartwig's still
Yeah.
here on campus.
Uh-huh. Yes,
Um,
yes, yes. He just played a pivotal role in supporting me through those struggles, and also just anyone who's ever met him knows how amazing he is. He just bolsters you up, and he's your number one cheerleader, and he's just freaking hilarious. And it's just he's brilliant. Just one of those faces I look back on my education, and I'm so happy that we crossed paths.
so you just described kind of a trying time while you were here at Touro. What are some of your fondest memories of your time here at Touro?
Oh my goodness. This is going to sound really weird because it should be like a scary memory, but I loved being thrown to the wolves. When I was fourth year, I was a third year medical student. I had to go to Arrowhead for my OBGYN rotation. Scared out of my mind. Just, I don't know anybody down there. Like my parents live in LA County, but it was still like an hour and a half away from them. So I had to stay basically with a family in Airbnb. I don't even remember how I found them. Maybe on Craigslist, which anyone listening, don't do that now. But I'm still in touch with them, and they actually live here in Orlando now. But anyway, the Arrowhead rotation was hard. They really expect you to kind of like hit the ground running there and to be almost functioning at the level of a second year resident as a medical student. I thrived with the challenge. I just like dove into it. I was like, you know what? I imposter syndrome, fine, but I can do this, you know. And I just when I didn't know something, I grabbed a resident, I grabbed a preceptor. Honestly, that whole experience, looking back on it, I'm so happy I did it. I feel really accomplished by going there for that rotation. And part of me thinks I would have been even more prepared for residency had I gone there for all of the rotations. But I loved being able to experience so many different beautiful types of medical settings. From like this really quaint practice near Mount Tam with a physician who calls himself Flash Gordon. And he's just incredible, just like such a fun guy, and his patients love him. And then from places like Arrowhead and so many other the hospital in oh, I'm forgetting where the freeway exit, but it was the one near Touro, the tiny one, Doctor's Hospital, I think is what it's called, which I don't know if that is even still around anymore. But that one where I rotated a couple times through cardiology with David Weiland, MD, and really learned the most about IM that I could have prior to starting residency from Dr. Afsari, and had some of my most heartbreaking first experiences as a medical student, just in terms of seeing the struggle that some of the patients were going through, and um, you know, really learning my medicine well. So I would say those clinical rotation years, as hard as they were, I look back on that challenge, as one of my fondest memories.
Oh,
I
that's
do want to
great.
mention something else, though. convocation. The American Academy of Osteopathy has a convention vacation every year called convocation. And back when I went and John Glover, was in charge of the OMM department, we would have the highest showing of any osteopathic school, and all of us would go and learn new manipulative techniques. And honestly, the amount of personal growth that you make in 2 to 3 days at Convo is equivalent to like 6 months of growth at school. It's incredible.
Wow.
Yeah.
So you mentioned your practice earlier. Tell us a little bit more about what you're doing professionally.
So in this practice, like I said before, it's a very rapid paced practice. I see 20 patients a day and I see 80 a week. So it's a 4-day work week. I spend the rest of that time with my family. I have a 6.5-year-old son named Isaac and a 3.5-year-old named Annalise, my daughter. And at the practice, it's super, it's very interesting because I have so many different types of patients that I will see in a day. I will see, a 102-year-old woman who's been completely healthy and just wants me to mash on her back to make her back feel better. And I will see a newborn baby with latching problems. And then I will see a variety of hypermobile patients from different etiologies. And just being able to, essentially what I do is I put my hands on, I'm a 10-fingered osteopath, that's what they call us, and I assess the patient, I find the somatic dysfunction, and I treat them. And I also do run, workup related things. I write for labs and diagnostic imaging orders. I consider myself to be like a non-surgical orthopedist, where people can come and I can be the go-between to let them know, well, here's what we need to do to prevent you from having to undergo a more potentially damaging type of intervention.
So, so kind of a last check to try to prevent the need for surgery, if I'm understanding you correctly.
In some cases, yes, and in some cases, like the hypermobile patients, they're just trying to exist in the best state that they can because it's very difficult to live a life where your connective tissue just doesn't work right and it doesn't keep things in the proper place. And so it's just creating space and helping those tissues find a better anatomical position, improving the structure so that the physiological function can resume in the highest, healing potential.
So you mentioned working with when you went to Arrowhead and you were, if someone would ask you something you didn't know, you'd grab a preceptor.
Yeah.
Um, have you found yourself serving as a preceptor as you've moved through your
Yeah.
career, or
Mhm.
being a mentor to student doctors?
That's been really important to me because I even had this feeling going through medical school, just the idea that, okay, I'm going to have to pay all this forward. Like, there's so many people who are dedicating extra hours, like Janet Burns and Charlie Beck. They used to come to Suitcase Clinic. They weren't paid for that, and they would precept us. They'd come to lunches. I don't know if they were being paid for that, and just kind of hands over hands. That's one of the best ways you can learn these techniques. Um, and just, many people who took me for rotations, especially during fourth year when I don't know necessarily that they were even being paid to have me there. And if you're really precepting well, it kind of slows you down. And it can be a little bit of a burden having a student if you are allowing them to learn in the way that they need to. And so I decided I'd have to pay that forward. And I have. I've taken a ton of students from essentially this regional area. I've also had a couple come to me from Touro, which I've been very
Oh, great.
pleased by. People with family in Florida. I jokingly and lovingly call this my students' Disney rotation, because I live really close to Walt Disney World, and so naturally, with a 4-day work week, they're going to Epcot and Walt Disney World, related, resorts. while they're not in the office with me. And amazingly, we have an osteopathic medical school not too far from my practice, 10 minutes away, that's actually opening up this fall with its first class of students. And I am currently signed up to be an assistant, well, not assistant, an associate clinical preceptor with that school. But that would probably be a ways out when they start sending students my way. So we'll see what happens. A lot can happen between now and then. But for the time being, I'm enjoying the students that have come to me from various schools like PCOM. Right now, I've got somebody from Lake Erie. I've had a lot of people from New England, many people from the Florida schools, Bradenton and Nova. So I enjoy it a lot.
Yeah, I know the field is expanding greatly. The Touro University system opened its new College of Osteopathic Medicine in Montana. They've got their
Oh,
first
wow.
class of students there going through this year. So
Amazing.
their first years, they are founding members of that College of Osteopathic Medicine. And I
Wow.
know here at Touro University, California, I don't know if you have heard that the accrediting body is granted permission to expand the class. It's been 135 students since I
Yeah.
think forever, and it's going up to something close to 200. Don't quote me
Wow.
on the number, but it's a significant increase.
That is, yeah.
We've got a building here on campus. I can look at it out this window right here. It's under construction. It's scheduled to open this summer, and a lot of the College of Osteopathic Medicine classroom work is going to be shifting over into that revamped building. It's like
Oh,
a
amazing.
$7 or $8 million project.
Wow, that's incredible. I had not heard about that. That should be a really wonderful addition.
Yeah, yeah. So it's going to be a lot more student doctors here on campus starting in the fall.
That's good. And then subsequently, more DOs going into residencies in the Bay Area and going into practice
Right,
there. So that's
right.
good.
And like you, all across the country.
Yes,
Yeah.
absolutely. Yeah, that's good news.
So I met you at OMED in October, and you were a presenter.
Yes.
And then you've presented in January at Advent East Orlando. You've got a technique of orthopedic cranial manipulative medicine, as I understand it, that you've
Yeah,
kind of developed, and you're being asked to share this technique with folks. Why don't you tell our listeners what that's all about?
absolutely. Well, I've said a couple times now that I work in a really rapid paced environment where I'm having to manipulate around 20 patients a day on a full day. And so, what I've had to do as somebody who is usually smaller than a majority of her patients is to utilize techniques that allow me to penetrate deeply with my palpation in order to create the most potential for change in the smallest amount of time. And I've honestly found that osteopathic cranial manipulative medicine is the field that lends itself to that the most. And within that field, there's a couple of different techniques: balanced membranous tension and balanced ligamentous tension. And what I decided is that most of the time I'm not, I'm doing those techniques. I can treat the ligaments and I can treat the membranes, but a lot of the time I'm really on the myofascia. And I'm on for those of you who have read anatomy trains and have experienced, the fascial trajectories from the feet to the head, you will know that you will often be on one part of the body and you'll just start to feel it kind of connecting and unwinding in another part of the body. So what I've done is I've adapted the balanced membranous tension and the balanced ligamentous tension techniques to deal with the fascia. And to explain it in one or two sentences is rather difficult, and it's even hard to explain in just 3 hours of time, like I did at OMED. But essentially, you're finding you can think of the fascia like a taut bed sheet. It has layers of taut fascia, taut bed sheet layers, and in that fascial layer where you're treating, there'll be like a twist in the sheet. And if you're looking at a twist in a bed sheet, you can see the ripples coming out from the center of the twist. So what you're doing is you're assessing the body and you're essentially jiggling the body, trying to find the areas where there might be a twist in the bed sheet, right? And then you're going to those areas and just, palpating one side of that twist and another side of the twist and gently following the mechanism until the twist is undone. And what this is really about, because the fascia is the organ of the body that is in charge of energy transmission, absorption, and release. So this is about taking an area where there's a ton of stored potential energy, usually in the form of trauma, and you're activating a route for which that energy can leave. And you can think of this as, resetting the blueprints of the body. And it doesn't just help the fascia, it helps all the connecting tissues around it, the muscle, the bone, and it helps with how smoothly the interstitium can flow. And we do know from studies from Donald Ingber and other people who have studied the mechanics of DNA being affected by mechanical work, we do know that this can impact the body down to the cellular level. Where you're releasing trauma, and then that could potentially affect DNA transcription and gene expression as a result. And so I went through all of these points during my talk, and then I also taught people how to do a standing treatment, which is very important because, as you know, we're visual organisms. We use mostly our visual, occipital lobes, our visual cortex, in order to perceive the environment, and we need to keep our eyes level with the horizon. So it's important to treat your patient standing once you're done with them so that they can reset their center of gravity and continue to function and build upon your treatment in a more physiologically functional way. And then we talked a little bit about grounding and how to maintain as the practitioner, as the operator, how do we stay grounded and just set in ourselves so that we don't take on some of the stuff we're releasing.
Wow. So, I mean, you've been away from Turo for a dozen years now almost, but it sounds like between what you've done and what you're doing, you're basically living the motto of to serve, to lead, to teach. And
I
that's
certainly do
wonderful.
feel like it, yeah. I'm so thankful for just having had the opportunity to go to Toro. It was exactly where I needed to go. I think back on it fondly. I think back on my friends and the faculty there and all my mentors. And that's why I sought you out at OMED to introduce myself and say hello, because it's just a lovely place to be working at, and I'm glad you're there.
Well, I want to thank you for taking the time to join us today. We're about at the end of our time, so I think we'll wrap up. So again, thank you for taking time out of your day to join us, and
Absolutely,
like
yeah.
like to thank our listeners for listening. So until next time, take care, everyone.
All right, thank you.